Welcome back to another episode of the Mug Hub, and once again I'm very lucky to be joined by two of our student pharmacists who have joined me once before. Vironia, Patrick, thank you very much for coming back.
Thank you very much.
Thank you for having us.
What year are you in now?
Year 3.
Yes, year 3. We're both in year 3.
Year 3, blimey. God, it only seems like yesterday that we were welcoming you in through our doors into year 1. So Patrick, tell us a little bit about how the course has developed, like changed since we last spoke, because we last spoke when you were at the beginning of year 2.
Yes, at the beginning of year 2, yeah.
Yeah.
So with year 2, we did exams. Probably the big thing to point out was we did exams in March. So then once we'd done those, then it was structured a little bit differently year 2. Did exams in March. Once we'd done those, then we went out on placement.
That is quite different. So they were your like end of year exams.
Earlier on than the end of the academic year.
Okay.
This year's a little bit more back to normal, if you will.
Yeah.
As we have exams at the proper end of the academic year.
Yeah.
So some other groups and my group now, we've just been out on placement.
Okay, before we go into placements, and I really want to know about that and about your experience, I remember around March last year and the exams like being on the horizon just before it, and it was a bit stressful.
It's a fair description.
It's a bit stressful.
It's a fair description.
Yeah, I think so. What's your view on it now, in like after you had done them? Was it nice to have had that out of the way so you could concentrate on other things?
What I'd say, at least personally speaking, and I know from speaking to some others as well, it was quite a big thing that we all anticipated in the lead up to it.
Yeah.
And it definitely was stress. But at least for myself, once I'd done it, I had the relief of like, oh, they're actually done.
Yeah.
Like they're out of the... Because exams are a big thing, especially if you've never had any break from coming from school to A-levels to uni. Psychologically, exams are like, you know, God tier. They're the be all and end all. Although they're not, and there's plenty of other things
Feels
as well.
that way.
But once you could sort of see that once you actually got past that, and then from there on to the end of year 2, there's a variety of things. Obviously, other assessments like OSCEs as well.
Yeah.
Some group presentation to do, coursework to do.
Oh yeah, we kept you busy.
Absolutely, absolutely.
Good. Good. And so year 1 was focused on the healthy human. Year 2, you started moving into more clinical cases.
Yes.
Year 3, now you're going into a bit of comorbidity, I believe, and seeing patients that have got numerous different medications on their drug charts and different conditions coinciding.
Multiple things all happening at once.
Exactly. So, yeah, the expectation, I guess, on you has gone up a bit.
Yeah.
Let's think about the placement then, and what you're getting out of that in year 3, and sort of maybe even reflecting back a bit onto year 1 and year 2. But let's focus first of all. How has your placement been? I know you've both just come back from placement.
Yes.
So maybe Vironia, tell us where did you go? What did you do? How was it?
Okay, so my first 2 weeks were, 1 week was in Croydon University Hospital, so it was a hospital placement, and basically we looked at different, so for my ward, it was an acute medicine ward, so we looked at different patients in that, so it's like patients that transfer from A&E to that ward before getting discharged to their houses or further wards. It was interesting to see because we were learning about all the comorbidities in year 2 and year 3, so we built up on that. We also saw like how there's an MDT in place, like the nurses, for example, they take lots of vital signs from the patient to see if the patient is doing well or not. You got the carers, for example. We had like people that were on social carers or like their family members coming to support them. We got patients that were like, I don't want to say deteriorating, but like they weren't
getting better.
They were not getting better. So it was like how to ensure their last days in the hospital are as smooth and painless as possible for the patient. And then we had like patients that were just treated and then they just went back to their normal lives. So it was like a whole variety of things that you could see.
Yeah.
Yeah.
A rich experience.
Yeah. And then the second part was GP, placement in Brighton Station Health Centre.
Okay.
And
hang on a moment. How long did you have in the hospital, did you say?
1 week.
1 week,
Yeah.
okay.
And it was 1 week virtual for it. And then, so virtual, it had like the biochemistry, like we had tasks to do, like dealing with difficult conversations.
Ooh.
Yeah.
Like online learning
Online
packages?
learning. Yeah.
Okay.
And then biochemistry, like lab results, see what it could indicate, what it means. For the GP one, my GP placement one focused more on deprescribing. So
yeah. It's very hot topic.
Very hot and very hard, actually.
Ooh, tell me more. What's hard about it?
So we had a patient who had high doses of opioid.
Okay.
And we had to tone it down, like deprescribe it. And then the way the pharmacist did it was she started with the concerns he had from that opioid, and then what he expected the opioid would help him and how it would not help him. So, and then when we looked at it, we started tapering it down slowly.
Brilliant. So it sounds like you've got to see lots of different things.
Yeah.
Well, I'll come to you in a minute, Patrick. Well, maybe you can both answer this one. So you were given a logbook of tasks to complete as well. So how did that help you structure your experience? Do you want to start this?
Yeah, I mean, I'd say so. For example, my placement, I'm now on the virtual week that Veronia mentioned.
Okay.
Virtual part of the hospital, 2 weeks.
Everybody does things in a slightly different
group,
order.
Yeah, exactly.
Okay.
Different people within a lab group do stuff at different points, and then different lab groups go out through the year. So everyone's somewhere different.
Yeah.
But for example, I've been to Jersey for 2 weeks.
Nice.
So that was mainly community pharmacy, but there was a chance as well to have a tour around the hospital as well.
Okay.
So it was a joint sort of tour of the hospital. So to go up onto one of the wards, the acute medical unit, and also see the dispensary as well.
Oh, brilliant.
And also look around the office of the chief pharmaceutical officer.
Oh,
so that involved
for Jersey.
For Jersey,
okay, because you're quite used to meeting chief pharmaceutical officers, aren't you?
Just a little bit. Yeah, just a little.
Okay.
That's for under the government of Jersey.
Okay.
So that involved meeting a few different pharmacists. So, for example, one of them, she was working on regulatory affairs.
Yeah.
So she was explaining that her role kind of takes on the MHRA, the GPHC, and some of those functions as well, all within under one kind of roof, if you will.
So do they have different regulatory
So this is something that I've learned.
powers in
This
Jersey?
is something that I've learned quite a lot about with Jersey.
I bet you do.
Is that in a short space of time, is that it's what's called a crown dependency. So there are some similarities and there are some differences with the UK, especially obviously relating to the health system and the structure of how that works.
Yeah.
So for example, I learned like you'd have to possibly pay to see a GP rather than seeing one for free.
Oh, okay.
But then there are some other differences, like you don't pay for prescriptions, where you do here in the UK.
Oh, okay.
And some other things like
we're all learning here.
Yeah, exactly. Yeah, like Schedule 4 CDs are treated differently to here in the UK.
Huh.
So there was quite a lot of interest. I'd say my main kind of takeaway interesting point from Jersey is that there's a lot of regulatory differences.
Yeah.
Which, because it at a glance seems very similar to the UK, I didn't appreciate before that. But especially getting to look around the hospital, getting to chat to some of the pharmacists working under the chief pharmacist.
Yeah.
That was a brilliant experience.
Oh, that's great. Okay. So presumably there were lots of similarities in terms of the clinical cases that you were seeing and the way that care is delivered. So yeah, coming back to those placement tasks, what was it that you had to do on placements? What kinds of things were in your logbook?
So we had adherence screening.
Oh, tell me more about the adherence screening. That sounds absolutely fascinating.
So basically we had to talk to patients about how they're finding the medications, whether they're taking it as prescribed or not, and whether they had any concerns really.
Oh, so so I'm particularly interested because I've been involved in setting this up for you guys. So you've been trained specifically to use this screener, and now you've gone out. So you did the training in year 2, you've gone out into year 3, you're using it. How was it using the adherence screener?
It was actually, it made life easier, I'd say. So you built a rapport with the patient, and then from there you took, for example, if a patient say inhaler technique, for example, first you would build the rapport, and then you would see what is worrying them. Why are they not taking the inhaler as prescribed? Is it like like you got intentional, non-intentional?
Yes. Oh yes, it's all very familiar.
Yes. So and then you essentially, because in placement that we were told not to like give any like advice, because we're still students and everything, but it was easier, like the patient felt more relaxed than when and they also felt relaxed with pharmacists than doctors for some reason.
Oh, that's
like,
nice.
It was an interesting, like the doctors, they would be professional, with pharmacists they would be like a bit relaxed, they can talk and everything.
That's great.
Yeah.
And I think that's something that we've tried to get across in the classes as well, is that it is supposed to be a conversation starter. So if it is enabling that sort of relaxed conversation, brilliant.
Yeah.
Okay.
And then in terms of the reflective placement, so that would be the same for everybody when they do that part wherever they go. So for example, GP, for example, Jersey, that involved 4 kind of CPD related entries.
Okay.
So 2 planned, 2 unplanned. So for example, say for the unplanned one, I saw a case where the pharmacist was doing a consultation with a mother that brought in her child who'd had symptoms of hand, foot and mouth disease.
Okay.
So I didn't expect that. So then obviously I wrote about that. That was a great one.
Yeah.
The other part was a peer discussion as well. And then also there was 2 sample prescriptions you had to kind of write.
Okay.
So one of the pharmacists I'd worked with, she had just received her independent prescribing qualification.
Right.
So that I went a little bit further, and I used that as a chance to talk about prescribing in general, talk about what she's getting involved with, and obviously, consult with her to have a check through what the little sample prescriptions that I did.
Yeah.
But that was really interesting as well, to speak to somebody, because I don't think I've spoken to somebody before that has just literally gone through the programme of independent prescribing.
So hang on a minute. So they have just finished the M-Pharm and are qualified, or they've done the 1 year add-on?
They'd had experience, and now they were doing the independent prescribing.
Okay.
So they were doing it as a kind of
something
postgraduate.
that you will not need to do.
Yeah, exactly.
So happy about that.
Are you happy about that?
Yeah.
I mean, literally, because like sometimes I worry that, students coming through now are thinking, oh, it's a bit of a burden to have this extra clinical responsibility. Maybe not burden, but
it was an interesting
more,
kind of
it?
junction of speaking to somebody where that is still very much the current kind of system just about, and then actually you were reflecting back, for example, onto our cohort, thinking, wow, you're right, we won't have to do that.
No, it's just standard. It's just going to be part of what you're doing. Although I still feel like we're not quite sure what that's going to look like in practice for you.
We had some great conversations about what that will look like in practice and how it can kind of be implemented, or maybe not sometimes.
Yeah, brilliant. So your 3rd year now of doing placements, how do you think they compare across the years?
So I think that in year 1 we had more exposure to community pharmacy. So we had to see how the pharmacy works. So where when the prescription goes in, what happens in the dispensary and screening, and then when it comes out, the flow inside the pharmacy. It was more focused on that. Yeah. In year 2, it was more focused on starting to think about the diseases the patients could have from the prescription, and then why they have been prescribed this. So it was, in year 2, it was more limited to not complex diseases like the general pain or GI, diabetes. And then year 3, right now in placement, we were exposed to complex patients. Yeah. Lots of comorbidities, and then lots of medications. How does it alter the patient's clinical health in general? Do we need to deprescribe? Do we need to monitor? Yeah. What happens if the patient deteriorates? What do we stop? What do we continue? Yeah. So it was building from the smallest thing about how a prescription what it happens inside the pharmacy, how it goes out to the patient, to how to treat the patient as a whole, not just the symptoms, but underlying cause of that symptom.
Absolutely, yeah. So I think in the planning of the degree, it was very much anticipated that everything would spiral as you go through the 4 years, what you're learning in the lectures and the workshops, but also those tasks in the placement. So does it feel like that to you, that things are sort of, you're revisiting similar concepts each year, but at a more complex level?
Theoretically, you know more.
Theoretically, you know more. Well, hopefully, practically, you know
Hopefully
more
do,
as well,
of
Patrick.
course.
I mean,
of course we do.
Practically, right now, so I was speaking to my colleagues earlier, and we actually felt like in the hospital, like last year when we had the courseworks and stuff, and they told us what would you de-prescribe, what would you prescribe and stuff, we were quite reluctant. We were like,
Okay.
we don't know what we're doing actually, like we're scared to take that step.
Yeah.
But now, like given the guidelines, given seeing the real life scenarios, we're a bit more confident in like just go like what do we de-prescribe, what do we monitor if we're de-prescribing. It actually built our confidence. Like
That's so good to hear.
Yeah.
Brilliant.
And next week I'm going out on the actual real life.
Oh,
hospital
okay,
placement.
yes.
So I'm very.
Which hospital are you visiting?
I'm going to the Queen Victoria Hospital in East Grinstead.
Okay.
So I'm really just sitting here and hearing it. I'm really excited to actually
Yeah.
literally go out and do it and see it in person.
Absolutely.
Yeah, you have so much fun.
And you've finished all of your placement time now?
Yes.
Okay, so
yeah.
you're now focused on doing the workshops
And the coursework.
and the
essentially.
coursework. Okay.
And I'm just over halfway through.
Only 1 week left, I guess.
It's intense, year 3, no? A little bit.
I think year 2 prepared
I think
us.
year 2.
Yeah,
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 year 2 was
yeah,
like
year
the
2
most
prepared
intense.
us.
Okay, good, because yes, you had an intense sort of work stream structure in year 2 as well, and then that funky kind of setup with the
Yeah.
exams. So that was going to be my next question then, is what advice would you give to somebody in years 1 or 2 about, I don't know, either preparing for year 3 or coping with year 2, whatever, however you want to take it really.
I think if you can get through year 2, you can kind of get through anything.
Yeah, it is like the battlefield at this rate.
Okay, note to self, do not air this at the beginning of an academic year.
Yeah,
So-
no,
yeah, or don't let new second years listen to it.
But yeah, I would say that the thing I would mention is in year 3, it's quite like you finish lectures before Christmas, and then like so end of November, beginning of December, you're out on placement if you're the first group.
Yeah.
Year 3 is quite relaxed. You have lots of time, but the problem comes with managing your time because all the coursework is due in April. Then you have OSCEs in May.
Yeah.
And then you have audits in May, and then you have June exams. So you do have like time to relax, you have time to study, but it's more time management in year 3 rather than anything. Yeah, because the content is quite chill compared to like other contents. Yeah.
I think also it probably feels a bit like that way because now we've done year 1 and year 2 content, we've got a really solid foundation.
Yes.
So I think sometimes when you push on a bit further, when you've got to a good level already, it's easier to push a bit more. Whereas when you're starting off, a smaller push can feel like a massive jump.
Absolutely true, yeah. And like you said as well, that you've now got a bit more confidence in the clinical decision making that you're involved in. So that takes that pressure away as well.
It does.
Yeah. Okay, and then going into year 4 then, because that's going to come around very quickly, and I'm going to find it quite challenging, sort of seeing you all as 4th years after.
Seeing us all graduate.
Yeah, well, God, seeing you graduate, it's going to be lovely, absolutely lovely, but it's also going to feel like, oh, God, they were only here for like a year, surely. But you haven't. You've been here for almost 3 years now, going into your 4th year.
Yes.
What steps are you taking to sort of mentally prepare yourself for all of that, or even like academically
I've got
prepare?
a couple of ideas in my head of what I might be interested in regarding the 4th year project.
Okay.
So because I know some 4th years as well, that's been helpful because I've had some chats with some different people.
Yeah.
So it's kind of nothing is solid at the moment, but it's kind of helped me in my head to even at an earlier stage like now, just have a little bit of a formulation of maybe some ideas, some areas that I'm interested in, even for example on a sort of basic level of do I want to go maybe lab-based or non-lab-based.
Yeah, I think that's sensible to start thinking of that, and towards the end of the 3rd year you'll be asked to say what your preferences are, won't you?
Yeah, I think we'll start like thinking about projects and also like the oral exam, I guess.
Oh yes, yes.
Yeah, because that determines like your whole pre-reg year, and you don't want to like actually like flunk it, you know, like.
You really don't want to flunk it, no.
But yeah, other than that, I think 4th year, every single person that I encountered, they'd be like, it's chill. Like, as long as you know what project you're working on and you have it like time managed until like the deadline of March, then everything falls into place. Like,
Yeah.
I think you hit this really weird kind of turning points, crossroads, where a moment ago, where at any given point, a moment ago, when you're in year 1, year 2, you're looking back right to the start.
Yeah.
Now where you are, you're looking ahead to the light at the end
the
of the tunnel.
finish,
You're like, we're getting there.
Yeah, you definitely
amazing.
are getting there. And what I have heard from students in the past is that this last bit, I know you're not in the last bit just yet, so don't worry, but once you're in the 4th year, that goes incredibly quickly.
Yeah.
As I'm sure you can
Everything
imagine.
has.
Everything has.
Everything.
Well.
Yeah. But how much you've learned and how much you've developed in the time that you've had here already, and then imagine what you're going to be like when you come out of your 4th year. You'll be ready to smash those pre-reg exams at the end of that foundation
I
year.
think what's amazing is you learn so much beyond just kind of clinical or academic knowledge. In a sense, yes, you learn how to obviously be a practitioner, but I think you learn a lot about yourself as well, which is quite an interesting kind of reflection I've had recently.
Yeah, definitely. I mean, well, for many students, it's like your first time of living independently, away from family members, setting up, new friendship groups, things like that. Actually, the academic part can be a relatively small part of what you're doing.
Compared to what, self-growth and everything.
So long as it's not too small.
Not as long as it's not too small. Absolutely right. Well, thank you so much. I'm going to let you get back to your 3rd year workshops because I know that it's a busy day.
Yeah, unfortunately.
I'll take that as a fortunately.
Of course, I was testing you there.
I heard it. And thank you so much for giving up your time to come and talk to us again.
Thank you very much.
Thank you so much
It'd
for
be
having
an honour
us.
to reappear one day.
Yes. Thank you.
Thank you. And that brings us to the end of another captivating episode of the Mug Hub podcast. We hope you enjoyed today's discussion and took away valuable insights that will fuel your passion for pharmacy.
Remember to subscribe to our podcast and stay tuned for future episodes where we continue to explore fascinating clinical topics, introduce you to incredible individuals and enhance your skills to bridge the gap from bench to bedside.
If you've any questions, topic suggestions, or you'd like to get involved, we'd love to hear from you. Connect with us via our social media platforms or send us an email.
Until next time, keep learning, keep exploring, and keep engaging with your studies. Thank you for joining us at the Mug Hub podcast.